Okay, this is a 23-year-old mom, preemie gravida, and she's come in with profuse bleeding. She hasn't had any other complications until now, but they are doing an emergency C-section for a placental abruption. She is bleeding a lot, so they're just doing that right now. I anticipate the baby will be out in about a minute, so you do have a little bit of time to set up.
Okay, so since I'm anticipating acute blood loss, I'm going to be ready for an emergent UVC placement.
Perfect.
So I'm going to open up my supplies. This is my sterile field. I have my UVC catheter, my stopcock, and my flush is already there on the field. I have my 3 betadines, my scalpel, my umbilical tie. It's actually called umbilical tape. It's for tying. And my sterile suture removal kit, so I have instruments to use. And then I'll go ahead and put my sterile gloves on. And then my drapes also. I want 2 drapes ready. Now that did fall off a little bit, but again, this is emergent, so I'll be aware of that when I drape the baby, and I'll use that part to be on the baby's skin. So in an emergent situation, we're as sterile as possible.
Okay, the baby's coming. Baby, of course, is pale and not really breathing a whole lot. Probably needs some CPAP.
So while she's administering CPAP, I'll go ahead and get prepared for the UVC placement.
You're getting good chest raise with the CPAP, and your heart rate's about 90.
So draped the infant. The next thing I would do is I would use my 3 betadine swabs. Jen, can you go ahead and just hand me the package? And in an attempt to preserve the mannequin, I'm not going to actually use the betadine, but I would do normally clean from the top to the bottom of the umbilicus down to the skin with 3 swabs. 3 swabs. And then after I've done the cleaning, the next step would be to tie the umbilicus. And I'm putting this tie as close to the skin level as I can, tying it with enough pressure that I will stop bleeding when I cut, but not so much pressure that I can't then pass the catheter. What's our estimated weight on this infant?
Baby's estimated weight is 1,200 grams.
Okay, so since it's less than 1,500 grams, I would be planning on placing the UVC 2 to 3 centimeters in depth. I'm going to cut the umbilicus with the scalpel about 1 centimeter from the level of the skin. So I would cut it. Then I'll flush the catheter before I insert it into the umbilical vein. I have my little instrument to secure the umbilicus. Now I know that this is the vein because it's thin-walled, it's round, and it's large. So I can differentiate it easily between the two arteries that are much different in appearance. And then I check to see if I get blood return, which I do, and that it flushes easily, which it does. And then I'm going to go ahead and give the baby the emergent fluid replacement of 10 mils per kilo, so about 15 mils.